Hi, class. Now that we've covered all four types of tissue, the first system that we talk about is the integumentary system. When we talk about the integumentary system, we're talking about the skin, hair, and nails. It's protecting your body. When we look at the skin off to the left, we'll see this top layer. That's called the epidermis. And it's made up of 5 microscopic layers. We have the dermis, which is made up of just these 2 layers. Below the dermis is the hypodermis. Here, you'll see that we have the shaft of the hair. We have a sebaceous gland. Sebaceous, this is your oil gland. We have a sudoriferous gland, that's your sweat gland and sweat duct. Here's the gland itself. Here's the gland and here's the duct. We have arteries and veins. We have muscle. Here's the erector pili muscle right here. This is the one, when this contracts, it makes your hair stand on end. It gives you the goosebumps. We have nerve fibers. And these nerve fibers are like for pain sensitivity, for hot, for cold. We have pressure receptors, right? So we have epithelial tissue up here in the epidermis. We have connective tissue because we have blood and blood vessels. We have fat, that's connective tissue. We have muscle tissue. We have the erector pili muscle. And we have nerve tissue. We have the Pacinian corpuscle and some nerve endings. How cool is that? You'll read about the 4 different types of skin cells, the most predominant being the keratinocyte. Melanocytes produce melanin. That's for your skin pigmentation. Your Langerhans cells, these are immune cells for your immune system. And then we have touch receptors, tactile receptors, touch receptors. So in the epidermis, I said we have 5 layers of skin. These are the microscopic layers, and they all start with the word stratum, like stratosphere, it means layer. And from surface, from superficial to deep, it's Cher loves getting skin Botox. Cher loves getting skin Botox. So you have the stratum corneum, many layers of stratified squamous epithelium. Stratum lucidum, lucid, it's a clear layer. Stratum granulosum, it's a granular layer. Spinosum, it's a spiny layer. And the stratum germinativum, also sometimes called stratum basilar, this is where your stem cells are. Okay. Cher loves getting skin Botox. Now, these are the 5 layers that are found where we have thick skin, like the palms of your hands and the soles of your feet. In other parts that have thinner skin, you're not going to have this lucidum layer. You won't have a lucid layer. It'll have 4 layers. But where we have thick skin, we have 5 layers, including that lucid. So again, you could see on the left, Cher, you have the stratum corneum. Now we don't see the lucum, we don't see the lucidum, so it's Cher loves getting skin Botox. So this is only 4 layers, it's thin skin, but off to the side, you can see what's happening in each of the layers, but you can see the keratinocytes, you can see the immune cells, we can see the cell junctions, the desmosomes. Okay. You can see the melanocytes down here at the bottom producing melanin, which is the skin pigmentation. So now on the Connect McGraw-Hill, here's the skin, and it's asking you to drag and drop for all the different layers. Okay, so the entire top part is the epidermis, which is made up of the 5 layers, and way down at the bottom, that's the dermis. So we have share, loves, getting, skin, Botox, stratum corneum, stratum lucidum, granulosum, these are granular layers, they produce oil, spinosum, the spiny layer, and down at the bottom is the stratum basal layer. Highlighted blue aqua area, that's the epidermis. Below the epidermis, that's your dermis. And below that, that's the hypodermis. So again, epidermis, epidermis, dermis, hypodermis. Top layer, 25 to 30 layers of stratified squamous epithelium. That's the stratum corneum. So what happens is you have these cells that start down here and they migrate up. By the time they push up to the top, these are all dead cells that slough off. This takes about 4 weeks to happen. It's about 30 days, 4 weeks to get to the top. They slough off, your stem cells make more, they move to the top, they slough off. When you have psoriasis, it can happen in like a week's time. The word pasati in Greek means fish, because fish have that shiny, silverish kind of layer to the skin, and that's what psoriasis looks like, the flaking, silver, dry layers in the front of the knees, behind the elbows, or behind the scalp. So we have share up here. Here's the loves. That's your stratum lucidum. Stratum lucidum. That's this layer right here. All the way down at the bottom, that's going to be the stratum basal layer, yellow. That's going to be the stratum basal, aka stratum germinativum. Germinativum. Now, way down at the bottom, these hills, these are part of the dermis. They make these hills, so they're called dermal papilla. These are involved in making your fingerprints, the unique fingerprints that you have coming from those dermal papilla. Okay, and then just to review the different skin pigmentation, if you have a printer that takes cyano, that means blue. That's blueness. Sadly, when a child drowns in a pool, they pull them out. The lips are cyanic, cyanosis. They're blue due to the lack of oxygen. When fingernails are blue, when lips are blue, when ears are blue, it's due to the lack of oxygen. The opposite of that is erythema, which is redness of the skin. That's due to dilated cutaneous blood vessels that are seen with inflammation or a sunburn. Yellowing of the skin is jaundice. We'll see that with liver disease, and it's due to an accumulation of bilirubin in the blood. Now, if you're an individual with darker complexion, you may not see yellowing of the skin, but you'll see it in the white of the eyes. The white of the eyes may look yellow, very common in people that have some sort of liver disease. People that are albino, these are people that have this genetic lack of melanin, so there's no skin pigmentation. That's called albino. The skin is very, very white. Or when there's patches of white, they'll call it vitiligo, which is areas of the skin that may not have melanocytes where other areas do. That's called vitiligo. Okay, when we look at the nails, we're going to finish up here with the nails. Think of the nails similar to the skin, where right back here, you'd have the matrix, which is where the stem cells are. And the stem cells multiply and divide, and they push the nail up this way till you get to the free edge. This is dead nail. This is where you can cut without any pain or discomfort. The nail body, this is what should be pink. Okay. When it's white, we think of anemia. Should be pink or red. Back here is the cuticle or the apontium, and the half moon shape is the lunula. When we look at the finger from the side view, same structures. Let's start from the back. Here's the nail matrix back here. That's where you have the stem cells. And then you have the nail root, which is here. Here's the cuticle or the apontium. Here's the lunula. And here's the nail bed or the nail body. Should be pink or red. And then here's the free edge. This right here is the nail body. And back here is the nail root. Now, when I do a physical exam on my patients, the first thing I do is I shake their hand, I turn the hand over, and I look at the nails, because the nails can pick up a lot of metabolic diseases. When you see this thickening here and the nail curving down like this, they call that clubbing of the nails. It's typically seen where we have decreased oxygenation, like lung cancer. We'll also see this not just with lung cancer, but we see it a lot with irritable bowel disease. This is what it looks like, clubbing of the nail. See how thick that cuticle is and how it kind of clubs down? So we'll see this a lot with decreased oxygen in the blood. We'll see it with inflammatory bowel disease, cardiovascular disease, liver disease, and even with AIDS. When we look at the nail and we see how white and pale that is, we typically see that with anemia, whether it's a B12 anemia or an iron deficiency anemia. That's the whiteness. When we look at the nail, look at that. This is part of cancer. This is part of a skin cancer. It's called a subungual melanoma. Okay, you can pick up skin cancer of the nails as well. When we look at these type of candle wax dripping of the nail, we typically see this with endocrine conditions, whether it's diabetes, whether it's thyroid issues, whether it's Addison's disease, anything with hormones and endocrine, we'll typically see that linear candle wax appearance.